Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to another episode of the Healthcare Connections podcast. I am your host, Jeremy Winn, the Director of Sales here at Healthcare Compliance Pros. We've got another one of our own here at HCP as a guest today. We've brought back Chad Schiffman. He's our Director of Compliance and Risk here at Healthcare Compliance Pros. Welcome, Chad. Thanks for coming back.
Yeah, of course. Good to be here.
This is part two. We've been trying to do a part two for a while, but we figured we'd save it towards the end of the year. And we call this the Chad and Jeremy episode in lieu of was it a 70s rock band, Chad? You're more familiar than I am.
Probably much earlier than that.
Maybe 50s, 60s rock duo. So we'll have Josie cue up some music as we take this podcast out of some Chad and Jeremy. But yeah, excited to have you on. So here's what we want to talk about today. This is again right towards the end of 2025, and I thought it'd be good to, Chad, have you talk about some of the things we've seen over this past year with the new administration. There was obviously, a lot of uncertainty, with Mr. Kennedy and Dr. Oz coming in. What are they going to do? What are they going to focus on with HHS and everything? So maybe talk through some of the highlights from the year, things that we learned, things that did happen, things that didn't happen, just some high level notes.
Yeah, so it's actually been a fascinating year. I think there was, with the shutdown and different things like that, different initiatives that came out throughout the year, whether it's focusing on, nutrition, for example, has been a big focus for Kennedy in this case. So yeah, I mean, that's been a big focus and a high priority item. Obviously, OCR was without staffing for quite some time, but that really might have slowed what we would have expected in some of the enforcement activity, but it didn't stop it. We're still seeing it come out. The majority of those enforcement actions have been from incidents that happened early on, maybe in 2020, 2021. So I think there's a backlog that they're working through. Yeah. And so it's going to be interesting to see how that continues to unfold. Some of the things that I feel like we didn't see were the proposed privacy rule updates. Got a little bit delayed. So did the security rule updates that were proposed, at the end of the Biden administration.
Yep.
So we'll talk a little bit more about that, I believe, as our conversation continues. Those, I think it's just been a fascinating time. I mean, there's a lot of the executive orders and different things that we've had to be aware of, just to see how protections may or may not impact health information. That's been a big focus for us, especially as we're working with our clients, is trying to have them understand that even though that things are still kind of going under some changes, you still have some obligations there, to safeguard this health information. And we'll talk a little bit about why that's becoming increasingly apparent for even those organizations we feel like aren't traditional healthcare covered entities or business associates.
Yeah, so it's been a little over a year ago, the OCR launched their security risk analysis initiative. I think we're in double-digit enforcements this year. And that's even with the shutdown that you alluded to, where the OCR was not staffed for a little bit. So maybe talk about what we've seen from those enforcements. What are the key areas of findings and the emphasis that healthcare organizations need to be aware of?
Well, I think the emphasis really comes down to cybersecurity and how that intersects with the HIPAA security rule and the obligation of performing an accurate, comprehensive security risk analysis.
Mhm.
Quite often, organizations feel like it's okay to just check the box and complete that unfortunate task that we have to do, whether it's a review or update each year or if changes come out. But from a HIPAA perspective, it's an obligation, it's a requirement, and it becomes quite aware when we're going through this enforcement actions that OCR looks at those very heavily. Quite often, what we're finding is it really starts and ends with an EPHI inventory. Our organization's maintaining a comprehensive inventory that considers all sources of EPHI, where it lives, who's responsible for it, its life cycle. All those things need to be considered amongst other elements that we're finding. And we get a lot of organizations that say, "Hey, we've added our desktops, we've added our laptops, we've added our servers. We're good. That's where EPHI lives." And in the mindset of OCR, what we found is they want everything, even some of the documentation things that you maintain in certain locations, considered as your EPHI inventory. So
Hmm.
that's one of the biggest lessons I feel like we've learned through these enforcement actions. If organizations have a good handle on that, it really does help us truly assess risk within the organization. And you can look at a lot of these enforcement actions that have happened recently that continues to be a primary focus, along with what are they doing to safeguard against stuff like ransomware and any bad actors that could
Yeah.
access their data.
Okay. Yeah, really good information. So I want to talk about this. There's a new proposed bill that is just kind of making some waves. It's from Senator Bill Cassidy out of Louisiana around some potential updates. I believe is it HIPAA privacy and security, or maybe just HIPAA privacy rule. But maybe talk about what is in this proposed bill, some of the ramifications that we'll see across the industry if it does get passed. It's obviously just proposed at this point, but very interesting, um, bill that's out there.
Yeah, and what I think also what's interesting with it is the timing of it, because, and we'll talk about this again a little bit more with the proposed HIPAA privacy rule actually going to be heard, or I guess, uh, the HIPAA privacy rule that came out in 2021, we'll call it. Initially, those proposed updates that are actually going to be looked at in roughly the summertime of 2026, along with the cybersecurity rule
Hmm.
or security rule updates, we'll call it. All those, well, the timing of it is kind of interesting because there is some information that regarding right of access within Senator Cassidy's bill that seems to be sort of different, I guess we'd say, than the proposed HIPAA privacy update. So that's going to be interesting to see how that gets resolved or heard or and is considered. But yeah, with this proposal, what it's looking for is though that health data that maybe from wearables, from other devices that could potentially access, store, create, download any, maintain any individually identifiable health information. So the in organizations who house that, so in terms of this could include yoga studios, in fact, from what we're seeing. It could
Yeah.
include more medical spas and aesthetics who, obviously we've been under the impression like, hey, look, it's a best practice. You just need to go ahead and implement HIPAA requirements.
Right.
There's a greater focus on that and a greater concern. So, I feel like the organizations that we've advised to do that are going to be a step ahead as this gets considered. So, all that health information that has been loosely enforced by the FTC, we'll call it, uh, is now looking to fall under HIPAA's rules. So it's going to be interesting to see how that goes. Some of the protection that I feel like is rather interesting in there is AI data that you may need to have consents to use that individually identifiable information. That's a big consideration there if that gets pushed through. And then just the obligations of ensuring that that information that you obtain with AI, you're getting the minimum necessary information or utilizing the minimum necessary information, which has been a HIPAA standard anyway. There are other provisions throughout this rule that we could go through line by line, but I think at this time, I feel like it's just important to know that, hey, Washington's waking up.
Yeah, Washington's waking up a little bit to this.
They are, we're starting to see more and more, come out like Senator Cassidy's bill. What led to it, I don't know. I mean, I don't know if it's just AI. We've seen a lot of chatter on AI, like potential proposed executive order that could potentially happen. That's at this point more or less speculation, but we could see it. Uh, so there's just a lot of interest in safe utilization of AI, obviously.
Agreed.
That could be part of it, but I also wonder if it goes back to stuff like, if I had to guess, maybe like the Garmin breach or different things like that that have occurred, and other incidents that have involved wellness and health data that's been compromised.
Yep, around the wearables, yeah. And I think the growth of the aesthetic space, obviously, anytime an industry is booming like that one is, it captures the eyes and the attention of everybody. And I think from what this proposed bill sounds like is they're trying to make sure that there isn't a differentiation between whether it's a cash pay based medical service or not, or if it's insurance or Medicare or Medicaid. Um, Essentially, HIPAA is going to apply. Those rules, it sounds like, are going to be, they're going to treat that PHI the same, no matter the payment method. I mean, that seems to be what they're going for, at least for that portion of the bill.
Yeah, I think there aren't going to be really many exemptions if they're dealing with individually identifiable health information, or what they're calling, I think they're calling it applicable health information in the proposed rule, which is any data that's tied to that, individually identifiable health information that
Mm-hmm.
talks about past, present, or future healthcare received or payments of healthcare. But see, there's some clarification in there that it includes all types of information that it hasn't previously in the past considered
Yeah.
protected information. So that to me is really fascinating. So we'll have to watch and see how that goes through. Um, there's also some talk too. I think this was another interesting proposal in there about confidentiality of substance abuse disorder records, to
Hmm.
bring it more in alignment with HIPAA standards versus those Part 2 rules. So that could be interesting to see if that unfolds as well.
Okay. That leads us into maybe the last part of our conversation today. So we've talked about what we've seen in 2025, this proposed bill that is looking ahead a little bit and maybe giving us kind of cracking the door on what might be coming. So let's just jump into what you're anticipating for 2026. We've got the administration in for a year now. What do you think their focus might be going forward? And what are you anticipating next year?
I think one more thing that I should mention is that Pearl case that was challenged in 2024 with the reproductive health,
Yeah.
those rights, that basically wasn't appealed by HHS, and so the state stayed in place, which effectively ended those obligations for healthcare organizations, which was kind of a big deal. So I think that leads nicely into 2026, in that some of the requirements we're going to see are healthcare organizations are going to be expected to review and update their notice of privacy practices, make sure that's in alignment with that proposed rule, because that part still stayed in.
Mm-hmm.
So we're going to want to make sure, and I believe we have lots of content on that, and we can definitely help them in that review and update if they need it. So that's going to be critical that they look at that. As mentioned earlier, they're going to look at the HIPAA privacy rule updates, mostly around right of access, would be my expectation on that. There's a big focus on continuity of care and access to information right now.
Mm-hmm.
So some of the proposals were changing the time frame from 30 days to 15 days, for example. So we'll keep an eye on those and see if that gets any traction as well as they look at it. I mean, Again, who knows at this point
Right.
what could potentially happen? Will they enforce it as, or will they implement it as proposed? Who knows? I would say all bets are off at this point, and it would remain to be seen. But we do know that it is a high priority, so I would guess that it's going to look quite different than the proposed rule once it comes out, if it comes out this year.
Yeah.
Might be delayed, we've seen that. Same, and then with the HIPAA security rule, I do think that cybersecurity is a high priority, no matter who the administration has been, and has proven to be so. So I think organizations are still going to be expected to do their security risk analyses, maintain those policies, ensure that they're preventing bad actors from accessing and compromising health information for sure. Huge concerns with ransomware, of course. That's a big deal right now, along with phishing. So I think we'll continue to see that. I don't know. We didn't get a cybersecurity newsletter recently at the end of 2025. Will we see one? I don't know. I would love to receive one. There's usually some good information in there. So we'll see if they get back on that track when it comes to 2026. So those are just some of my thoughts. I do think there will still be a focus on fraud, waste, and abuse, particularly in the Medicare programs. We've seen a lot of activity there this year, so I would expect that would continue in 2026. There have been some different target areas which have been interesting, like we're seeing DME targeted heavily, for example.
Yeah.
And some different things that, and it's going to be fascinating really to see what reach out, they reach for these different claims and analysis where there's waste and abuse. So,
Yeah.
Yeah, so those to me are the big items that we'll see. It'd be fascinating though if we actually get an update to the privacy and security rule. It's been quite some time.
Yeah, it would be. I anticipate something's going to happen for sure. It seems like there's a lot of momentum there. So, Chad, thank you so much for coming on. Look forward to regrouping again. We'll do another one of these as we get partway into 2026 and see, as we get additional insight, first quarter of the year on what those priorities are looking like, and maybe, movement on this potential bill from Senator Cassidy. So we'll have you back on here to talk through some updates. Thanks, Chad. Appreciate it. Always good to have you on.
I appreciate the opportunity. Thank you.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.